Greetings, I'm Dr. King Schutz. We are doctors that's currently dealing with COVID-19, both working on the vaccine and slowing down the spreading. So, COVID-19, let's talk about its nature. It's a quite infectious disease. It's hard to detect because if it doesn't show up the symptoms, people would not go to hospital to get themselves checked. Uh, but you should still not going outside at all during this pandemic. Like in many countries too, they maintain the extreme lockdown, and we are in the support on that. Extreme lockdown should be maintained until the vaccine has been developed. Because if a lot of people going outside, like start socializing in a very crowded place, and the symptoms show up, they will have to go to the local hospital, which of course do not have enough medical staff, and medical facility will be absolutely full. They can't do anything. They will be overwhelmed. They can working on cases enormous like that. It's inevitable that hospital will not be able to treat each patient equally. So we have to lay off some that we just have to deem unsavable. So right now, I mean, we suggest, even recommended for you to stay inside. Don't go outside until the vaccine has been developed. Thank you.
I agree that countries should maintain extreme lockdown measures until a vaccine is found for COVID-19. I believe that it's likely to be a second wave if we not maintain a lockdown measure. I mean that there is not only a second wave, it can be a third wave, fourth wave. According to a research show that China, Korea, Iran have second wave of infection. The infection have rise again to pandemic after reopen their country. It's not safe to say that reopen country will save for us, even we have a low number of cases. As we know that COVID-19 spread really quickly, we need a vaccine to ensure our life. Some people keep worry about economic growth. They want to live on normal life and build some kind of herd immunity. I don't think that herd immunity idea will work. There is no guarantee that we will create immune against COVID-19. There will be a chaos at the end if we can't create immune. And another thing is the elderly and some people who have pre-existing condition, they have very high risk on COVID-19. Okay, they are a few in population percentage of mortality rate. You're not concerned, but if the field population is you or your family, I believe that this field percentage would be very important to you. We shouldn't overconfident and we shouldn't underestimate COVID-19. All I want to say is two words: safety first. Thank you.
My name is Liang Hyun Chao and my stakeholder is an officer from World Health Organization. For me, I personally agree with the statement that countries should maintain extreme lockdown measures until a vaccine is found for COVID-19. I absolutely believe that the extreme lockdown measures can help to prevent the spreading of the COVID-19 effectively. Lockdown encourages people to stay at home and be careful of the infections. This measure can help to reduce the risk of COVID-19 infection because COVID-19 spread by droplets. If people avoid social interaction with each other as least as they can, the number of infected people will be decreased. According to Dr. Sam Flexman's study order from the Department of Mathematics, Imperial College London stated that lockdown and school closures have saved about 3.1 million lives in 11 European countries. They analyzed data from 11 countries in Europe, including the United Kingdom, Spain, Italy, Germany, and Belgium up to 4th May 2020. This study shows that extreme lockdown measures can lead to the control and prevention of the infection from COVID-19 and can save many lives. So this is the reason why I support this policy and I strongly believe in this statement. Thank you.
Hello everyone, we are economists and here we are going to present our argument against the statement that countries should maintain extreme lockdown measures until a vaccine is found for COVID-19. In my opinion, the lockdown results in mass unemployment, and if the government continues to impose the lockdown even longer, the economy will collapse and people will end up being jobless and face the lower quality of life. I agree that a way to stop the infection is to keep people safe at home, but it's better if we figure out a way to allow people to work safely during the pandemic with some effective preventative measures so people's well-being and their career won't be affected at all. Center for Infectious Disease and Research and Policy reported that the United States has lost 20.6 million jobs since mid-March, resulting in the unemployment rate of 14.7%. This is a level that hasn't been seen since the Great Depression in 1930s, which was the worst economic downturn in the US history. The number of jobs lost more than doubles the number seen in 2007 to 2009 Great Recession, when 8.7 million Americans lost their jobs. The unemployment rate is very devastating, as we can see. So instead of imposing the lockdown and stopping people from working, we should find a way to allow them to continue to work with safety, with some restriction, with some preventative measures during the COVID-19. And here, health and safety executives suggest how to manage workplace secure during COVID-19. First, risk assessment. Second, social distancing. The third one is cleaning, hygiene, and hand washing. Fourth, provide useful information for your workers in an organization. And the last one is that you have to make sure you consider the risk to workers who are particularly vulnerable to coronavirus and put controls in place to reduce that risk. Thank you.
Many industries can keep going with social distancing rules. Since the strictness of lockdown in many places, all industries have to be closed unacceptably. But there are many industries can keep going with social distancing rules. It is because the business doesn't risk as much and it's possible to run while following social distancing to keep their life going in many countries. Small businesses, for instance, fishing, house planting, they are forced to stop working, even their jobs are not related to crowded places where risks to get infected. According to BBC News, Nicola Sturgeon, a minister of Scotland, stated that people working alone providing community services such as gardener or window cleaner can continue to work if they can go about their businesses safely. This can be good for community and it would be encourage them to do so. Employees should ask themselves whether they can operate in line with safe social distance practice and normal health and safety. People have to survive by working to get money. Their business is essential to fight against coronavirus. The coronavirus cannot keep us stuck in home forever. I believe that our life we can live our life as normal with social distancing rules and we are still safe if we do strictly. In a study published in medical journal in Lancet, the scientists look at research into how coronavirus spread. They conclude that keeping in at least 1 meter from other people could be the best way to limit the chance of infection. And the study also said that for every extra meters of distance up to 3 meters, the risk is further reduced by half. So I believe that we can live our lives as normal since the social distancing can be can be the way that save our life. Many industries can keep going with that.
Okay, so I disagree with this statement that countries should maintain extreme lockdown measures until a vaccine is found for COVID-19. My standpoint is that extreme lockdown measures affect income of workers around the globe. In COVID-19 situation, everyone was affected by it, especially the large group of workers that they have to work for money every day. If the government wants to extreme lockdown measure, they wouldn't have money to live. It means that they don't have even food to eat during the quarantine, so that it can impact in another way also. Many companies have to close the workplace, so like workplace closures have an immediate and severe impact on enterprises and own workers. International Labour Organization claims that the prolongation and extensions of strict containment measures in many countries where such measures were already implemented cause a cumulative impact on workers. Therefore, the workers don't have earning and they have expenses to bear responsibility. If the government want to lock down measure until the vaccine is found, I think they might probably die from hunger first.